Everybody. I hope you're having a good day. So, I figured I'd come on and just give a little update of what's going on and where I've been, what's happening. I had to have emergency gallbladder surgery on the 5th of March, which is a little over 2 weeks ago. I went into the ER because I wasn't doing very well, and I was scheduled for the next day for surgery. Now, they were supposed to do it at the end of the month robotically, which I was kind of excited for. It was kind of cool because it's lower risk and less invasive, but it didn't happen that way. They had to add me to their schedule at a different hospital to get it done. And it was laparoscopic, which isn't too bad anyway, but I've had a laparoscopic surgery before. I've actually had two of them. This was the very worst I've ever had. It was super painful. It just felt like someone went in and tied all my inside up and just closed me up. It was horrible. My doctor did a little experiment and wanted me to stay on my medication the whole time instead of getting off of it like I did when I had my extractions. Worst experiment ever. I'll never do it again. It was awful. It took them at least an hour to get a baseline on my pain control. So for an hour, I was in excruciating pain until they finally figured out what they could give me to make it stop, which was a lot. 300 micrograms of fentanyl, a bunch of Dilaudid, a bunch of Toradol, a bunch of high-powered Tylenol, and then something else. And that made it to where I had to stop taking my medication, or else I wasn't going to have enough medication at home to combat the pain that I was having. So things just kind of went a little haywire while I was at the hospital. They couldn't get an IV in. I had an allergic reaction to some medication, and things were just all up in the air and crazy. The only really good thing that happened while I was there is they let me keep my teeth until I went in to go under, and they kept them at my bedside. They never separated me from my teeth, which was really nice. So they stayed in the operating room with me, and they put them in right afterwards in the recovery. One thing I can say is if you're going to have surgery or you're sick or something like that, and you think that throwing up might be something that you're going to deal with, rather take your teeth out or use adhesive. Now, I used adhesive because I don't like having my teeth out at all. But the last thing I can imagine I wanted to do was to fish my teeth out of a vomit bucket. I didn't have to do it, but I can see how it would be a really bad situation. So just keep that in mind. If you're going to have surgery or you're sick or morning sickness or whatever it is, just keep that in mind that it's like the last thing you want to do is fish them out of the toilet or a bucket or whatever. Adhesive's a great thing, or just taking them out completely. So that's kind of what's going on right now. I've got a respiratory thing that I'm also fighting. I don't know if it's due to the surgery and anesthesia or what, but I'm just not better. There's I've got like a pinched nerve somewhere or something that's causing nerve pain everywhere, like serious neuropathy, and it's really unpleasant. I still can't eat very well, and it's not because of really the gallbladder. It's just I have pain everywhere in my stomach. So they haven't figured out what's going on. So I have a bunch more tests scheduled, and that's kind of where I'm at right now. Just having issues, and it just kind of all of a sudden popped up after Christmas, after I had the flu. So who knows if I'm just having issues from that or something happened, or I don't know. But I'm just trying to recover. Gallbladder surgery was probably one of the worst ones I've ever had. It was super painful. I didn't have control over my stomach muscles because of the laparoscopic surgery. So I felt like I was 9 months pregnant for a week, if not longer. It was super uncomfortable. I couldn't lay on my side. I couldn't lay on my back. I couldn't lay on my stomach. It was just really uncomfortable. And I don't ever want to go through something like that again. Luckily, they didn't have to do a full open surgery, so because that would have been a lot worse. But this one was not very pleasant at all. No surgery is pleasant, but I've had a couple of them, and they have not been to any extent that this one was. It was terrible. So I'm supposed to change my eating habits, but I didn't have really bad eating habits to begin with before this, so it's not really that big of a deal, but I'm having eating issues. So anyway, that's kind of what's going on. We are packing because we're moving in June to a bigger house up on the hill away from the trains and the freeway and the construction and everything else. So we're a little busy trying to spring clean and get things taken care of so that when our move comes, it's a lot easier and simpler. My daughter moved back in, so we now have company again. She's occupying one of our spare rooms upstairs. So I'm back to the downstairs area of our house. Been kicked out by the teenager or young adult. And that's kind of what's going on. So I am going to tackle this weekend a Russell Klein video because there's a lot of questions being asked lately. The group is growing extremely well, but it's a lot of questions are being asked. And then also one about sleeping in your dentures, because I've seen a lot of questions about that lately in a lot of groups that I'm in, not just the Russell Klein group, but a lot of just general questions about sleeping in your dentures. And I can say that it works really well for me. It doesn't work for everybody, but common sense is a really big factor and just your own personal situation. So I'm going to talk about that over the weekend. And then I'm also going to make a video separately about my medication and how that worked or did not work for my surgery. So I think it's a really big thing because doctors right now are experimenting with it. And it's not for everybody. I would have thought that I would have been a good candidate for it because I've been on the medication for so long. Not the deal. It was an awful experience and I never want to go through it again. I've been seeing my doctor for over 7 years and he was certain that I would have done well with it. And a lot of his other patients have done well with it. I was the first one that hasn't done well with it. So it was kind of a big surprise. But it might be the milligrams that I take or how long I've been taking it. We don't know. It just did not work well for me. And it was a big shock. So I will give a little update on that separately on how that did not work and if you're on that medication. Just good questions to ask and things to look at before you make that decision going into a surgery or something that you might need pain control for, because nothing was touching my pain. Absolutely nothing. And I think it's really important to address it and talk about emergency situations with the medication and what the downside is, because that's kind of what I ran into. I didn't have a time to taper down. So anyway, I hope you guys are all doing good, and I promise to get some more videos out this weekend when I've got a little bit more free time and quiet around my house. I'm doing a service project for church where I'm videotaping ladies that we're going to put together in one big video. So I've had a lot of company lately and just visits, which have been pretty nice, but we've been doing a lot of videos in my house lately for it. So that's coming to an end at the end of this weekend. So I'll have a little more free time. But I hope everybody's great. And I hope that I can, chit chat with you guys. If you have anything you want me to tackle, put it in the comments. I promise I'll get back to you. I promise I'll read them. And I'm more than happy to look at suggestions if you guys need help with anything. So I will see you guys in the next one.